Hello, everyone. We're going to start the webinar. So my name is Abigail and I'll be your moderator for today. I'm a pharmacy technician from Singapore and a member of the FIP's Pharmacy Technicians Advisory Committee. I've been working as a pharmacy technician since 2013 at KK's Women's and Children's Hospital, and I'm currently in charge of staff training and the planning of continuing education topics. As an advocate for pharmacy technicians, I'm part of several national initiatives and work groups to better understand the needs of pharmacy technicians with regards to progression and training, and I hope to continue developing my leadership and mentorship skills. This webinar is being recorded and live streamed via YouTube. The recording would be available on the website at events.fip.org. You may ask questions in the Q&A box that's provided. You're welcome to provide your feedback at webinars@fip.org. And to become a member at FIP, please visit the membership registration website. Today's program, we'll be talking about the NHS pharmacy technicians workforce, as well as the US roles for pharmacy technicians. And it's a two-part series, roles for pharmacy technicians in telehealth services, as well as roles for pharmacy technicians in immunization services. And then we'll end it off with a Q&A. The learning objectives for today will be talking about career paths of pharmacy technicians in the UK, changes to the pharmacy technicians workforce in the UK, describing the implementation of technicians as immunizers in the United States, understanding the training and education need for technicians to administer immunizations, consider the future for technicians as immunizers beyond the pandemic, highlight several roles for technicians in telehealth, present the barriers employers are facing to recruit pre-registration trainee pharmacy technicians as well. Our first speaker, we have Rebecca. Sorry. With Rebecca has worked in the pharmacy for the past 24 years, and she's a qualified pharmacy technician for 13 years. She has worked in a variety of roles across different pharmacy sectors, including acute hospital community pharmacy, the BNF, and an integrated role as the NHS England Pharmacy Technician Lead for Southeast. She helps to support and grow the pharmacy technician and pharmacy support staff workforce by supporting employers, ensuring that there's a robust educational infrastructure in place, as well as governance and quality assurance processes. Rebecca is passionate about building a sustainable pharmacy technician workforce, ensuring they are appropriately trained and supported, allowing them to have the knowledge and skills to provide a service which supports patients' care throughout their journey. Rebecca will be providing an overview of her career progression, the barriers employers are facing to recruit pre-registration trainee pharmacy technicians in England and how these can be overcome, and how she supports promoting pharmacy as a career, engaging with school leavers to encourage them to consider pharmacy as their career choice. Rebecca, please. Thank you.
Hello and good morning, and thank you for the introductions, and thank you for having me today on what is here for us in the UK, the 75th anniversary of work of the NHS. And I'm very privileged and proud to say that I do work for the NHS. So as Abigail kindly outlined, so I'm going to give a brief overview of my career as a pharmacy technician and the impacts of COVID along the way, and some of the barriers that employers are facing recruiting pre-registration trainee pharmacy technicians. So these are those that are undertaking the qualification to become a qualified pharmacy technician, how we go about promoting pharmacy as a career here, and the changes that we're currently exploring as pharmacy technician workforce. So first of all, a bit about myself. So as Abigail said, I'm a pharmacy technician and I have been since January of 2010. And I've been in the world of pharmacy since 1999. A lot of people say that I don't look old enough to have been in pharmacy for that long, but I really am. For most pharmacy technicians, we don't really choose pharmacy as a career. It generally chooses us. When I was at school, choosing GCSEs and my A-levels, I was never told about the options of working in pharmacy. I often saw pharmacists, nurses, doctors working within the medical world, but I didn't really think that was a route that I wanted to choose. And I knew, but who really knew what pharmacy technicians did or whether they even existed, and the roles that they undertake. And these roles, they continue to change and develop year on year, especially since the pandemic, where we've seen a real shift in the services that we provide to our patients. I'm really passionate about my profession, and I will sing about pharmacy technicians until people walk away from me. And I think my passion started from interacting with patients and seeing the impact that I had with them. When I was in a community pharmacy working there, and seeing Mrs. Jones, for example, coming every Saturday morning, and the relationship you built with them, and knowing that they trusted in us to help them, that drove my passion to work in pharmacy. And now it's the trainees and seeing them grow that keeps my passion alive. So a little bit about my career progression. So from before I was a pharmacy technician, as I said, I started out in a community pharmacy. So back in 1999, I started off as a counter assistant working in community pharmacy, and it was actually based within a supermarket here in the southeast of England. And I stayed here throughout all of my further education. So whilst I completed my GCSEs, my A-levels and my degree, which is in something completely different, I continued working here in the pharmacy. That pharmacy was soon acquired by that supermarket, and that changed the way that we really worked. And it became very driven by that organisation and link selling rather than the patients. But I did learn a lot, and I always kind of furthered my knowledge and skills within the pharmacy setting. I completed a number of counter assistant knowledge courses. And once I completed my degree, which was in media, I wasn't really quite sure where I wanted to take my career, but I somehow ended up being offered a manager's position within the supermarket. But I really knew that that wasn't where I wanted to go in my career. And that really made me think about what I did want to do. And I had a local pharmacist who was working with us at the weekends, who worked in a hospital during the week, and she told me about this pharmacy assistant role that was being advertised. So I thought I'd give it a go, and applied, and I was successful in getting the job. And whilst working in that hospital, I quickly progressed from being a pharmacy assistant to being the senior pharmacy assistant, and then I went on to train to be a pharmacy technician. My roles here within this same hospital included dispensing, stock control, counselling patients, procuring of medicines, and working in the aseptics unit, producing TPN and chemotherapy. So I thought I'd just give you a bit of information around how we train here as a pharmacy technician in England. So up until about 3 years ago, you would have undertaken and completed a BTEC and an MVQ, which you would have done over a 2-year period. You didn't need to have completed any A-levels or have a degree, but you needed to have GCSEs in English, maths and a science. A new qualification was introduced in 2020, which combined these two qualifications, the BTEC and MVQ, into one BTEC. This happened after the GPHC, so our General Pharmaceutical Council, reviewed the initial education and training standards for pharmacy technicians, which was really long overdue, and the previous version was no longer fit for purpose due to the role of the pharmacy technicians changing and advancing. So the new qualification that we have that our PTPT, so our trainee pharmacy technicians, are undertaking, delivers to them an underpinning curriculum including chemistry, microbiology, physiology, actions and uses, law, pharmaceuticals, dispensing, pharmacy production, as well as professional practice and ethical decision making. And the biggest change is that it's also included medicines optimization and final accuracy checking of medicines. This previously had been standalone courses after you'd qualified as a pharmacy technician, but by combining it all together into one qualification, it really helps to further develop the skills of the pharmacy technicians from the point of qualifying. The entry requirements now are that you need to have GCSEs at grades A to C in maths, English language, science, and one other subject. And that does vary depending on your provider. Some will ask you to do functional skills if you don't have evidence of those, but the basic principles are that you need to have those 4 GCSEs. Often the qualification is funded via an apprenticeship route. So this is where organisations pay into the government levy via taxes, and they can then draw down the funding to pay for the PTPTs to be able to undertake that qualification. So there's not normally any cost to the employer or the trainee to actually complete the qualification, apart from the salary for that trainee being in post. Post registration, pharmacy technicians can develop their practice and build upon their initial education and training by accessing post-registration training. However, there's currently no specified pathways to enable this for us, which has recently been highlighted by the UK Commission Pharmacy Professional Leadership. And we are working on this to develop a pathway for pharmacy technicians post-registration. So within my own role, I then quickly qualifying as a pharmacy technician, I then went and worked for the BNF. There we go. So the BNF, hopefully you all know, is the British National Formulary, and it's basically our drug Bible here in the UK. And in that role, I was editing and updating the publications on a 6-monthly basis. But unfortunately, I didn't really feel like it was the role for me. I really lost that interaction that I loved from being with patients. And so I returned back to the hospital setting, where I undertook a role within the community, supporting services like district nursing, foot health, sexual reproductive health, and health visitors. So generally where there was medicines in the community, we were helping to support them with medicines queries, helping to produce patient group directives, helping them with safe and secure handling of medicines, for example. This then developed into a medicines optimization role, whereby we would then assess patients within the hospital or in their own homes to assess the compliance of the medicines. We would often deprescribe medicines where needed and put systems in place that would help support the patients improve the compliance of medication. Alongside this role, I was also the department's education and training technician, where I undertook further training for myself to be able to assess trainee technicians and assist them to complete their own qualifications. I knew then that this was an area I really wanted to progress in my career. And I eventually secured a dedicated full-time education and training role within King's College Hospital in London. During my 18 months with the Trust, I was able to support, train and develop both pharmacy technicians and the pharmacy support staff in successfully completing their training courses, as well as further development needs for qualified pharmacy technicians. It was during this role that the pandemic hit, and the way that we work changed and our focus really shifted. Training of PTPTs continued, but it became very much a virtual world for them rather than face-to-face lessons, and it was a real change for their learning styles. The teams were stretched and we needed to train in areas that we hadn't explored as pharmacy professionals before, including the preparation and administration of vaccinations. After this time, I then went on to apply for a role within Health Education England to support the delivery of excellent healthcare and health improvements for patients and the public across London, Kent, Surrey and Sussex, so the very southeast part of England. And by ensuring that the pharmacy workforce of today, tomorrow, has the right number of staff with the right skills, values and behaviours at the right time to meet the patient's needs. I then went on to successfully secure a role, which I'm doing now as the pharmacy technician lead for the South East for NHS England. So Health Education England merged with NHS England earlier this year. And now I get to oversee and lead on and work on the development and delivery of work streams specifically for pharmacy technicians and for the staff, pharmacy staff workforce, sorry, tongue-tied. And we really support the employers to support the trainees to get the most out of that 2-year training that they're undertaking and support the growing demand for pharmacy technicians. It might feel that we're out the other side of the pandemic now, but that we still feel the effects of COVID, and some are for the good and some not so good. And so I wanted to explore some of those impacts that we're actually facing within the NHS, which employers are finding when trying to recruit PTPTs, so those trainee pharmacy technicians. So since COVID, the number of applicants that they're getting for these trainee positions have significantly reduced. Pre-COVID, they used to get 100 plus applicants applying for these adverts and they'd close them within a few days. Now employers are getting only a handful and actually having to scrolled on by accident, I think there. Now employers are having to advertise more than once, and that's a real struggle for them and a real burden, and it delays that recruitment. COVID's really had an impact on individuals as well. So those that have completed the studies at home virtually over the last couple of years, they've been affected by not gaining that life skill and those communication skills that they might have had if they've gone to further education, potentially had some work experience or a part-time position before going into full-time work post education. And these are really being demonstrated through our trainees that are trying to undertake this full-time qualification and full-time position within the workplace. And we are finding, unfortunately, that some trainees are withdrawing from programme because they cannot manage working and studying and maintain that level of professionalism and those communication skills that we would expect of them. As previously mentioned, the training providers, the entry requirements can vary, and that English, Maths and Science is as standard. But we do find that it can be a barrier because not everybody has evidence of those GCSEs. So if we have an older person who's applying for the training, they might have lost their certificates, they might have got lost in a move. And if we're seeing overseas applicants applying, unfortunately, we need to have English as the first language in their qualification, not as a second language. So that often also is a barrier for potential candidates applying. And the apprenticeship funding that the training is often funded by, there's a lot of rules surrounding that as well. So previously, when we weren't using the apprenticeship funding, it didn't really matter the background or the qualifications that a potential trainee had before. Whereas now, under the apprenticeship ruling, if a potential candidate has undertaken a qualification that's the same or roughly around 50% the same as the training that they now want to undertake, they're likely not going to meet the apprenticeship funding rules. So, for example, if a candidate has done a degree in biomedical science, the modules might be too similar to the qualification that they're going to undertake and therefore wouldn't qualify for the funding. And we've had a number of candidates who have previously undertaken the MPharm in the UK, where they've gone to train as a pharmacist, possibly not been successful in completing the endpoint exam, and then have decided to become a pharmacy technician instead. But because the MPharm is too similar to the pharmacy technician qualification, they then are eligible for the apprenticeship funding. You also need to be a resident in the UK for a minimum of 3 years as well, which does have an impact on those potential candidates coming from overseas that wish to train as a pharmacy technician. Which then leads me on to the big sticking point about overseas applications. So before the 2017 Initial Education Training Standards review, there were some routes to join the register as a pharmacy technician if you'd been previously trained in the EU, EEA or non-EU and EEA countries. But after leaving the European Union and following the IET changes, there's no longer an international route to join the register. And therefore, pharmacy technicians trained outside of Great Britain, they're advised by the regulator to find a role as a pharmacy assistant or as a trainee pharmacy technician, and having to retrain for 2 years again to be able to register as a pharmacy technician here in the UK. There are no educational courses to support that accreditation of knowledge and skills from other countries like there are for the overseas pharmacists currently. And that there are it has been recognised that we do need to explore and support that workforce growth and recognition of transferable skills and knowledge. And as I've said already, the trainee pharmacy technicians do find that the demands of the service versus the study time can really impact them. The community pharmacies in particular are a very busy environment, and they struggle to release staff to be able to have their study time. So requirement of the qualification is that you have 1 day to study, whether that's attending a college face-to-face or having virtual lessons. They need to have that 1 day, and therefore they don't have that, they fall behind, and then they leave because they don't feel like they can catch up. And this is really heightened since COVID, as the services are expanding within community pharmacy and across hospital settings, but the number of staff within the workforce really isn't currently meeting that demand. So we are doing quite a lot of work within the NHS to be able to promote pharmacy as a career from that really early age, to trying to capture school leavers at the point of choosing their GCSEs. So from year 9, year 10, so that's kind of 13, 14 years of age here in the UK. We're trying to engage with the schools and talk to them about careers in the healthcare and in particular with pharmacy. And we have a number of websites here that we use and a number of schemes and opportunities that we will use with them. So we have something here called the Health Ambassadors Programme, which is hosted by our Inspiring the Future website. So that's the image that's there, and there's some hyperlinks here. So when the slides get distributed, you can have a look. But this is where we can sign up as healthcare professionals and either take ourselves to a school, or the school can contact us to be able to go to them and deliver an event. So that image on the right is an event that I went to a couple of months ago at one of our local universities, promoting healthcare and pharmacy in particular to the to the A-levels, so the 16 to 19-year-olds. And then we had a couple of other websites where potential individuals can go to find out more about pharmacy as a career. So we have our Health Careers website, which is that bottom right image, and then we have our careers map, which is this bottom left image. And this pharmacy careers, when you enter it, presents itself with a virtual world. And it's like a little town, and you can click on different sectors within that town to find out more about pharmacy as a career. So it might have hospital, GP, community pharmacy, even places like care homes, prisons. So you can go in there and see the pharmacy and pharmacy technician roles. And we have a number of case studies on there and videos. And I actually wanted to showcase one of those videos with you today from a pharmacy technician who is employed by a mental health hospital in London. But during the height of the pandemic, she was actually redeployed to one of our mass vaccination centres here. So I'd just like to share this video with you. How is that playing for you? Yeah, can't see it from here. Thank you. Abigail, I can't hear sound. Still no sound. Whilst we're just figuring out the sound, please do put any questions that you might have into the chat box. I'm happy to answer any questions around pharmacy technicians or pharmacy support staff here in England.
And I worked in COVID vaccination.
I can hear sound now.
The medicines always inspired me, enjoying challenges. I wanted to learn something different. So that's why I ended up working in a pharmacy. My name is Kimberly. I work in Central Northwest NHS Foundation Trust. I work in Lincoln Mental Health, and I work in COVID Vaccination Center, and I'm working in offender care as well. I got so many opportunities working from like assistant till MLPT now. But one of the best opportunity was working in a vaccination center where we got a chance to vaccinate 100,000 people. That was the best experience I ever had. I don't even have words to like what we had experienced, how we worked. It was such a brilliant team we worked with. People were losing their life, losing their loved ones. That was one of the biggest impacts on my life. We were just trying to serve our community. Talking to the patient, what they're suffering from, what kind of medication they're taking, and they start talking to you how they feel, and that give you a satisfaction that you're doing something for the patient. That's what inspired me a lot. Where I started my career was like an assistant, but then I became dispenser, then CPT, and I just literally did my medicine management as well. Managing the team, which I never did before, learning new things like doing a aseptic role, which I never did before. It's always something to look forward to. If I look back, yeah, what I was before and what I am now, make you feel proud of the work I'm doing. Patient care can give you a big satisfaction in your life.
So hopefully from that video, you were able to capture the real sense of achievement that Jatinder really got from helping support patients within the COVID centre. And I was there on that day that we filmed that video, and she had so much emotion around being with those patients, the struggles that everyone was going through, and knowing that she was helping her community and being able to support them was a massive part for her. And she's never going to forget that as part of her career, as I'm sure that anybody who was working within healthcare during the height of the pandemic is never going to forget. So my last section that I just want to talk about is some of the changes that are so changes to our pharmacy technician workforce. So the initial education training reform for pharmacists is really going to have an impact on pharmacy technicians. So from 2026, the pharmacists here in the UK will become independent prescribers from the point of registration. And that's going to help pharmacists to deliver more clinical orientated service and support expansion of roles provided by prescribing pharmacists in all sectors, particularly in primary care settings, including community pharmacy and general practice. Pharmacists themselves cannot operate in isolation, and they can only really progress and practice and improve the access for patients if they have the likes of us pharmacy technicians who effectively support the skill deployment. So by utilising the skill mix, pharmacy technicians will be able to capitalise on the status that we've achieved as pharmacy technicians, so they're having that professional and having the credentials to fulfil a number of tasks previously undertaken by pharmacists. Developing that role of pharmacy technicians is a real clinical, as real clinical practitioners in their own rights across primary care will help to move mainstream independent prescribing roles and help meet workforce challenges. The pharmacy technicians are hopefully going to start using PGDs, so patient group directives, to supply prescription medicines where appropriate, where previously we haven't been able to support that. So for example, with vaccination drivers, hospital discharges, and the provision of emergency hormonal contraceptives. And that's only going to greatly enhance the efficiency and effectiveness of pharmacy services in all patient care settings. So being a pharmacy technician now really is a great time to be in this field, and I can't wait to see what further developments we're able to undertake and grow and support the whole pharmacy workforce and the healthcare workforce to be able to support our care of our patients. So I have got any questions, but I think we're going to have a Q&A at the end instead. Back to you, Abigail.
Thank you, Rebecca. That was really interesting about the whole NHS and the development of the pharmacy technicians. We'll get to the Q&As at the end. For our second speaker, we have Kimberly, and she's from the US. Kimberly is an Associate Professor and Director for the Center of Pharmacy Practice Research at Washington State University College of Pharmacy and Pharmaceutical Sciences. Kimberly, please.
Thank you, Abigail, for that introduction. And Rebecca, what you've done is so interesting, and I appreciate the opportunity to learn from that. Let's see. And thank you to the FIP group for having me today. It's been such a wonderful organization. I'm also involved in the Pharmacy Technician Advisory Committee, like Abigail and Rebecca have previously mentioned. And so I hope I get a chance to see some of you in Brisbane and we can maybe talk in person. So today I wanted to talk about two different advanced roles for pharmacy technicians. I'm a pharmacist by education and background, and I'm a professor at a university here. So you may be wondering, what is my specific engagement with pharmacy technicians? I was a practicing pharmacist for about 5 years before I went into academia. And during that time, what I found is that I had a lot of amazing pharmacy technicians that I worked with, but a lot of the time they would hit a ceiling in their career that was a bit challenging. So they would go through training, similar but different to what Rebecca was describing earlier. They would be new career technicians and excited to be there and enthusiastic about their roles. And then over time, they would learn and kind of perfect all the tasks that they had. And there really wasn't much for them to do beyond those initial, kind of basic roles in the United States. So I really got to thinking, as pharmacists, we talked about being overburdened and overworked and just exhausted. And we have these amazing technicians who were not utilized to their full potential. So perhaps by implementing some advanced roles for technicians, we could balance out both. So I want to tell you a little bit about two of them. There's a lot of them, but there's two specifically. One is looking at telehealth services, and the second one is about immunization services. So first, what is telehealth? So really, this is communication between providers of some sort, in this case, pharmacists, and patients using some kind of electronic information and telehealth technology. So some kind of communication. This could be, it traditionally was been over the phone, but now really has shifted a lot to video visits. And so during the pandemic, this was really a huge benefit to a lot of patients. We know the pandemic was just catastrophic and awful in so many ways, but there have been a couple of positive things for our area of practice to come out of this. And so that's telehealth is one of those things. So this is actually really not that new. Telehealth was around and actually growing in ambulatory care pharmacy for about 2 decades before the pandemic. So while there's a lot of new research on this topic, the concept itself is not new. What are some benefits to telehealth services? So in this case, a pharmacist or a technician communicating with a patient. Well, first, it can increase the continuity of care. So if you have a patient who needs to be seen perhaps by a specialist or by a pharmacy team member in one community, and then they move to a different community, that's a way that they can stay in touch with their provider. Also, this is great for patients who have chronic conditions. There are a lot of limitations to telehealth, and I do want to address some of those as well. But for patients who have chronic medical conditions, are reasonably well established with their care and just need kind of routine monitoring, telehealth is wonderful. It also is great in areas where there are clinician shortages. So there's quite a few, and I'll touch on this more in a moment, but quite a few areas in the US, and I'm sure other countries as well, where there just are not enough providers to see all the patients who have need. So this is a great way to help address that. And then it greatly reduces the travel burden for patients. And this is absolutely huge and was huge during the pandemic as well. So if a patient can be seen by their physician, specialist, pharmacist via telehealth, as opposed to having to identify transportation, which can be hard for patients sometimes, get to the hospital area, then risk, am I going to get sick while I'm in a hospital area or an ambulatory care clinic and the people next to me are coughing? This can be a big help for that as well. And so, but there are limitations to this. So what are a few? A big one is that there's no opportunity to do labs, to do any kind of physical exam or direct observation of the patient. So like I said, there are patients that this is a great fit for and others that this is not a good fit for. So it's very important to identify who's the right patient for this. There are also concerns expressed by providers and patients alike about less personalization and less of an opportunity to grow and build rapport with patients. So what we found is that telehealth works very well when you already have an established relationship with the patient and you're more checking in on them and assessing how they're doing today, but you already sort of know them from in-person visits. There are a lot of challenges with technology. I'll talk more about that in a minute. And then billing, at least in the United States, has been quite complicated with this because should a telehealth visit be billed at the same rate as an in-person visit? Maybe. It kind of depends on the visit and what you're doing and what you would be doing, what would be comparable in person. So a lot of challenges with this area, but a lot of opportunity as well. This has been huge in rural and underserved areas, particularly during the pandemic. Where I live, I'm in a city called Spokane in Washington in the United States on the West Coast. And so we have, within about a 2-hour radius, a lot of patients who live in medically underserved areas and will come to Spokane for their healthcare. During the pandemic, that was a huge problem. And even outside of the pandemic, that can be a real barrier to having optimized care because patients don't necessarily see their providers as often as they should. So telehealth has been wonderful for that and a great way to increase patient access. So we know then the pandemic hit, right? Telehealth was happening to some degree before, but a lot of patients postponed routine care during the pandemic and were actually encouraged often to do so by their providers. For example, I have 4 children and their pediatrician for a while said, we're not doing any kind of routine well child visits. If they're sick, of course, we'll see them. But if they're not, we don't want them to come in because in those early days of COVID, the risk of exposure and just the unknown about the virus was pretty scary. So telehealth is a great way for patients to stay in touch with their different types of providers when an in-person visit is not a good option. I was involved in a research project on this topic. So we did some qualitative key informant interviews with a semi-structured interview script. So semi-structured meaning that we had a formal interview script, but we also left room for ourselves to ask more probing questions when necessary. So we'd maybe ask the person we were interviewing a direct question, but if they said something really interesting, we would say, oh, tell us more about this topic. And so we were asking, this was specifically to pharmacists to find out what was their experience and what was the experience, in their opinion of their patients. This was just a little study, but we learned a lot from it. And really in terms of looking at identifying the ideal patient, which is a huge role for a pharmacy technician. So first, who is this ideal patient? We really need to get folks who have some reasonable understanding of technology or have the means of having someone assist them and help with them. We talked to pharmacists who worked with a lot of older adults, and they had a really hard time using a phone, using an iPad, using Zoom, things like that. And so that was a real barrier when you have a patient who is frustrated because they spend half an hour trying to get connected and they can't figure out how to do it. Similarly, there are areas here where there isn't, good internet access. And so that is still really a barrier as well. The pharmacists we interviewed also noted that some patients did not take the visit as seriously. So when a patient shows up to an office visit, they come in, they're ready, they're paying attention, they know that they have a short consultation and they need to be ready. For telehealth, the pharmacist talked about having patients who called in from the bus or they called in from a kid's birthday party, which they were not in a situation where they were comfortable talking about their medical concerns, which was the whole point of the visit. And also maybe couldn't hear very well because they were in a place that was loud. So it was just really not set up for success. So it's important that we identify patients who are going to call in from a quiet private space, ready to talk, ready to treat it like any other visit. The no-show and cancellation rate is much higher also with telehealth visits. So making sure that you have a patient who's fairly reliable is important. We also learned that there are some medical conditions that are a better fit than others. So anything that needs to have, labs drawn at the patient visit isn't going to be a good fit. Anytime we're needing to conduct a physical exam or we need to directly read off of monitoring devices, that can be a problem. But there's also opportunity here as well. So for example, if we have a patient who has, very well controlled diabetes, and really during the office visit, they would just be talking about their blood sugar, they would be showing the pharmacy team members their glucometer and the readings on that, and having really a conversation more than anything else, that can be done easily over telehealth. Hypertension is another great example where if you have a patient who's routinely using a reliable blood pressure cuff, and some of them have, an app attached to it where you can send the data directly. This works really well for telehealth, but for those patients where maybe they're not monitoring it well, you don't necessarily trust the device that they're using, this is not a good fit. We also found that there's mixed preference. I thought this was really interesting for video and phone. Some of the pharmacy team members we talked to seemed to really think it went better talking over the phone because of the technology challenges with a lot of adults in using a video, that a lot of the time the video wouldn't work for some reason and they'd get very frustrated, where phone is very simple. Everybody's used to that. And then the last one, they said, that really to have an ideal patient, that everybody involved needs to feel like the quality of care is not compromised. And in most cases, the pharmacist really felt like that was the case. So if the patient is not having as good of an experience or as thorough of an experience because they're over a video, that's not acceptable, really. So we need to identify circumstances where the quality of care is not compromised. So what is the role of the pharmacy technician? I know that's what you're all waiting to hear. What is the role of the pharmacy technician in telehealth services? Some of these probably sound really familiar to like medication optimization or medication therapy management roles for pharmacy technicians, which are very tried and true. We have technicians that have been doing these things for years and years. And so even though the telehealth aspect may have been new for pharmacy technicians, the concepts were not. So first, pharmacy technicians involved were able to do some chart review and help identify who is this, ideal patient that I was talking about finding. Technicians did a great job. They know their patients too, being able to say, I think this patient would be a great candidate and here's why, or perhaps this is not a great candidate and here's why for telehealth. They also were instrumental in contacting patients and reaching out to them to see, are you interested in having a telehealth visit? Maybe explaining the pros and cons of a telehealth visit to the patient, and then doing some of the scheduling, which was amazing. Technology, as I was talking about, was really a huge challenge with this. So when you have adults, it was often older adults, but not always, who are not able to use technology very well. Having a support person involved in the conversation was huge. So we had situations where a pharmacy technician would perhaps make the initial connection with the patient. They would help them get the technology up and running. So get them joined on Zoom, help them figure out how to turn on their camera, and then the pharmacist could come in and do the clinical aspects of the visit, which was great. Technicians also did a great job of kind of gathering and organizing the information for the visit. And this is very similar to what we see technicians here doing for MTM or medication therapy management visits. So the technician, before the patient's visit, will gather all of the medication use records. If we need to find out lab values, they can call the physician's office and ask for those things, compile all of that together, and then be ready to hand it to the pharmacist so the pharmacist can come in and not need to spend as much time prepping to see the patient because everything they need is right there. Technicians also were a huge asset when it comes to note-taking and documentation. Here in the US, billing for pharmacy services is still quite a challenge sometimes in the ambulatory care setting. Not always, but in a lot of circumstances. So making sure that everything is documented perfectly is critical, because the insurance companies, if they see there are errors, may not pay for the visit, and the pharmacy would lose money on that. So having a technician who is trained in the billing area and can say, hey, you didn't document this part correctly, we're not going to get paid for this, before it goes to the insurance company, was an integral part of this, and it's just huge. So what are some of the benefits to the pharmacy technicians themselves? Because I think from what I've already said, it's pretty clear what are the benefits to the patients, what are the benefits to the pharmacists, but what did the technicians themselves think about doing this? So first, they were pretty interested in this as a new role, as something, like you talked about before, something new and interesting to do when they may have kind of already done the established tasks that they had previously learned. There were also a lot of positive interactions between the patients and the technicians as they were getting everything in place for the telehealth visits. My experience with research related to pharmacy technicians and a number of different topics has shown that pharmacy technicians really love direct patient care when they have the opportunity to do something interesting, in a really more hands-on way with a patient. And so this was a great way to do that. Pharmacy technicians played a huge role in technology support, so helping make sure that those visits were set up for success with the patients and troubleshooting any kind of connectivity problems. This saved a massive amount of time for the pharmacist. And I believe that a lot of the technicians involved, they specifically mentioned that and talked about how they were very proud that they were able to help the pharmacist who was maybe a bit burnt out, because so many are right now, help save them some time and some workload, and that it was really more like a partnership, which is great. Always what we want to see with the pharmacy support workforce. This also allows the pharmacist to focus on the clinical parts of the visit, and the technician can be involved in more of the technical parts of the visit, which has been great. And then, of course, everyone loves when we can bill and get paid. So having the documentation completed means the pharmacy is getting paid correctly for the services they provide, and that helps everyone. So kind of a summary for this, telehealth has become more common, still not, everywhere, but more common since COVID. It really does increase patient access to care in some ways when you have patients who don't have to identify transportation, or patients who have physical limitations to being transported somewhere. This can be really beneficial. Pharmacists involved expressed some concerns about technology and about the patient's level of distraction, or maybe not taking the visit as seriously as we would want them to. But the technicians played a huge role in kind of streamlining these services and make the whole thing just a better experience for everyone. And then lastly, it's important that when groups are looking at implementing telehealth services, that we make sure it's always very personalized and that it's very patient-centered. So always identifying who is that right patient. Okay, here are some of the references. I try to always add my citations on the slides, but here's the list at the end. Sorry, it's like 4:45 in the morning here, and I'm still my voice is still waking up a little bit. So I hope that gave you some good insight into the role of pharmacy technicians in telehealth services. And now I'm going to move on to the second part of my presentation, which is talking more about immunization services. So traditionally in the United States, as in before 2017, pharmacy technicians still played a big role in immunization services. It just was a different role. So before, my presentation here is going to be about pharmacy technicians administering immunizations, actually doing the vaccination, giving the shot or the jab, as my friends in the UK call it. But before that time, technicians still were an important part of the immunization process. So prior to that, technicians had a big role in identifying, who might be eligible for an immunization. So just asking patients, are you up to date on your immunizations? If not, are there any you think you might need? Or doing chart review to identify who specifically would need to be vaccinated, and then passing that off for the pharmacist for review. They played a big role also in scheduling appointments, like I was talking about with the telehealth services before, managing the inventory and the supplies, making sure everything was documented correctly, the billing side of things, doing follow-up phone calls, which got lost a bit during the pandemic, but I always did think was kind of a neat patient care thing, where you would, give someone a vaccination one day and then the next day call them, just see how they were doing, just sort of check up on them. We did not have time for that during COVID, but I think it is a great practice. And then what does the research show about the technician's role in immunization prior to actually administering immunizations? The couple of studies that I was reading about said that, really having the technician involved in the immunization process, even in a non-administering role, has a great impact on the patients in both the community and hospital settings. And that really studies showed that having technicians involved in the process increased the number of immunizations that were being given even before technicians could immunize directly. So a huge role for technicians in the in the immunization process. So now let's shift gears a bit and talk about technicians administering immunizations. I have a lot of data to share about how this went in the United States and how we rolled this out, but I will say we did not do this first. I believe Denmark did it first. I think pharmaconomists in Denmark have been immunizing for a while. So if any of you were on the call and you want to tell me how long, that would be wonderful. But this is not original work to the US. This was very novel and interesting when we started doing it, but we don't get the credit for doing this first. So my work with pharmacy technicians as immunizers began in 2016. And so I wrote a training program specifically to teach technicians to administer immunizations, because in the US, pharmacists have to go through a 20-hour program that includes a lot of content about immunology and how vaccines work, which is interesting, but is perhaps not a requirement at that level of depth, for a pharmacy technician. So I wrote a program that was initially 4, but ended up being 6 hours long. And it was initially implemented in the state of Idaho. So that's the picture on the left, the blue state there is Idaho. And we did some pilot research there, and a lot of people in the United States thought we were a little bit crazy for doing this. But what we found is it went really well. Pharmacy technicians were excited, nervous, of course, because everyone who learns to immunize is pretty much nervous. I teach immunization training for PharmD students, and they're just as nervous as my technician students have been. But it went really well. And so over pre-pandemic, we slowly saw this expand to go from just Idaho to add a couple more states like Rhode Island and Utah, and then some other states showed interest. And then the data on the right is as of April 2023. The blue are the states where pharmacy technicians can administer vaccines. And the light blue, they can do some immunization administration, but there are restrictions on it. During the pandemic, we've had a federal act that allows technicians in every state to administer immunizations as long as they followed specific rules. But that's going to end. And so now we're going to be back to 50 states and 50 different sets of rules. And so this picture on the right is from a group called NASPA, or the National Alliance for State Pharmacy Associations, which is a great group. They put this information out every year. And so this was current as of April. I will say that I have some colleagues who work in this area that I work closely with, and they've told me that 49 of the 50 states either have some sort of approval or have legislation in progress to get the rules changed, which is very exciting. This is a wordy slide. There's a lot on here, but I just wanted to briefly mention during the pandemic, we had an act called the PrEP Act. So it's the Federal Emergency Preparedness Act that allowed pharmacy technicians to administer immunizations, but there were very specific requirements around this. I get questions a lot, since this is an area of research I've worked in for a while, about, can any technician just start giving shots? And the answer is absolutely not. All technicians can be trained to give shots, but there are a lot of requirements around who can do that. So there are actually requirements for the pharmacists they work with as well. The pharmacist has to be qualified, and they have to be readily and immediately available. So supervising the technician, they can't be in another building somewhere, they need to be present. And then the technicians themselves have to go through a training program that must include a hands-on injection technique aspect. So this is not something that can be done completely over, virtual learning. You have to actually be holding a syringe and, giving someone a practice immunization to make sure that everyone is competent and able to do that skill before they're able to do that in a workplace setting. And they also have to have done some CPR training, and they are required to do 2 hours of immunization related education every year in their state licensing period. So this was just the PrEP Act, that federal act that allowed technicians in all states to immunize. State by state now it's going to be different, but this, I think, is a general overview of how this works. And so just to kind of wrap this up, what have we learned since my first project with this in 2017? This is just a quick summary of some of the research that's been done on this topic and what we've learned from it. So that first box on the left, technicians can be trained to safely administer immunizations. That was my pilot study that I published back in 2018 and is absolutely true. We've trained 25 technicians, and they went out, and in a span of 6 months, they gave 953 vaccinations to adults during that span of time. But they did great. They were great. It amazed me. I was so happy when I heard how many vaccinations they did. And I thought that was just great. And then the next box to the right of that. So this is a study that I think I published in 2018 that technicians can also immunize children and do very, very well with that. Some of the factors. So the third box there, is a study that was done by, I believe, Bill Doucette and some colleagues that were looking at technicians doing a whole bunch of interesting new advanced roles and which ones were they interested in doing and which ones were they more hesitant to do. And technicians were more hesitant to immunize than any of the other advanced roles. But the study also showed that some factors that address hesitancy are they trained? And the ones in the study were not trained to immunize. So of course, if you're not trained to do something, you're going to be less, you're going to be a bit hesitant about it in general. People feel that way. So I thought that was a great study and I needed to mention that. The furthest on the right in that top row is a study done by Matt DeMarco, a systematic review from some folks from the University of Waterloo, and really just looking at every paper that had been published on this topic. Overwhelmingly, the patient outcomes are really positive, which was amazing to hear. The number 9 there is a qualitative study that my colleague Taylor Birch and I did together. We interviewed a bunch of pharmacists who worked with immunizing techs and found the pharmacists thought this whole thing was great. And they did have some specific pieces they wanted to see done. And I have the paper in the citation if you want to read more about it. But the pharmacists were happy with this role. The next one, citation number 10 there, was a study with patients. So I had an honor student who interviewed a whole bunch of patients at a pharmacy, and what she found is that patients really trust technicians. And in fact, a lot of the time, they have no idea in a community pharmacy who's a pharmacist and who's a technician. They just see people behind the counter and they trust them. And it was not a big deal at all when we talked about, they're a technician versus a pharmacist. Do you care? And the patients did not care. This also included immunizations for children, which was kind of an unexpected outcome because I hypothesized that there would be a little more hesitation when children were involved, but the patients were comfortable, very comfortable with that as well. So some qualitative work has been done. I published a paper recently interviewing a bunch of technicians who immunized to see, did you like it? Do you not like it? How is this going? And the technicians and the pharmacists both really believe that technicians are absolutely capable of doing this role and that it goes very well. And then these last 2 papers were, I believe, by my colleague Taylor Birch too. And so we found that initially, supervising pharmacists were a little bit hesitant about this, going, well, how's this going to go? Am I going to not get to give any immunizations? Will the technician be doing all of them? Will they like it? And the technicians and the pharmacists, everybody involved really thought this was great because it was just such a wonderful teamwork dynamic. Pharmacists we talked to said, well, sometimes I give the shot and sometimes the technician gives the shot, and it really just depends on who's, the least busy at the moment, but it's great that we have the flexibility to do both. So this is just a real quick summary of some of the literature on this topic. There's more out there, but I didn't want to include too much. And then I think this is my last slide. What are some of the things, I just thought you'd enjoy these quotes. What are some of the things pharmacists think about immunizing technicians? So first, they think pharmacies are giving a lot more vaccines. This was actually pre-pandemic. So we know they were giving a lot more vaccines during the pandemic, but even during a emergency time, pharmacies give more immunizations in general when technicians are involved in the process. Everybody involved think this also really improved the workflow in the pharmacy, because if the pharmacist has to step out of community practice workflow and give an immunization, everything stops really for a few minutes while that is happening. So this way the pharmacist wasn't always pulled away. But also sometimes it's better if the technician is not pulled away, because if the technician is typing prescriptions, filling prescriptions, and that's time sensitive, then it's better if the pharmacist goes and vaccinates. So this is great for improving pharmacy workflow. The pharmacist also said they thought it really freed them up to do some other interesting clinical tasks or be more engaged with their patients. They also thought it actually reduced errors. When I started doing this in 2017, I had a lot of criticism from some different groups saying, oh, there's going to be a lot of vaccination-related errors if technicians do it, and that's absolutely not the case. We have good documentation of that as well. Technicians, and this is the pharmacist thinking this, the pharmacist said, I think this really empowers my technicians, which that's really what I set out to do in the first place. So I felt really good about that. And I love this last quote about the patients. The patients, approve of this as well. And here's a pharmacist that said, actually, they like the technicians better than they like the pharmacists. So this was no problem. I love that one. So I thought that would be a good way to wrap this up. Here are the references and some of the studies that I mentioned. I encourage you to take a look at them if you want to. And I'm always happy to chat about these. A few of these are mine. So if anyone wants to talk about them, please let me know.
Thank you, Kimberly. Okay, we can move on to the Q&A portion of this. Let me stop share for a bit. The first question we have is to Kimberly, and they want to understand how does an MPharm compare to a PharmD in the US?
Oh, good question. And so I think it really depends on what country you're from, what the terminal pharmacy degree is. So a PharmD here in the United States is our terminal degree. So to be a practicing pharmacist, you have to be a PharmD. But I've been doing some work recently in South Africa, and they have a Master's of Clinical Pharmacy that seems really similar to what we have in a PharmD program. So I wish I knew more details about it, but I think they're very similar, and it probably depends a bit on, what country you're in as to which is going to be your terminal practice degree.
Okay. Someone asked anonymously if they're able to get training online. I would assume that you're talking about the UK, or if you're able to practice in the US or the UK if you have a foreign degree. Would anyone like to answer this?
So I don't mind picking up from a UK perspective. So you do training remotely for this, but you need to be doing hours with it for work experience. So to be able to register with the regulatory body here in the UK, you do need to complete a minimum of 2 years of work experience alongside completing the qualification. So it's not solely online. You do need to be in the workplace as well.
Yeah, and I would just add, in the United States, unfortunately, every state has their own rules about who is a pharmacy technician and what does that involve. There are some, kind of standardized pieces of it, but I will say, in all instances, it's really recommended, or in some cases required, that technicians take a national certification exam. And I would think being a technician in other countries would prepare you very well to do that.
Okay, we have a question for Kimberly. What if someone who is an international pharmacist wants to work as a pharmacy technician in the US? How would they go about doing that?
Yeah, so there again, it depends on which state you're interested in going to, because there are states where really you can arrive and be a pharmacy technician and do a lot of on-the-job training. And I would think that your, previous skills from your other country would be a great fit in that, and you probably progress through very quickly. There are companies that do this while the technician is in a paid position at a pharmacy, and others that require it, other states too, that require it before you can be certified as a technician. So it really depends on the state. I'd encourage you to look at the Practice Act in the state that you're interested in and see what they say, because it varies hugely state to state.
Okay, there's something for Rebecca. Christine mentioned that in the US, pharmacy services are built separately than medical services. And in both areas, there are further separation of billing eligibility between the age under 65 and 65 and older with regards to government subsidies and all of that. Is there anything similar in the UK?
So I guess we're very fortunate to have the NHS in the UK in that if you are being treated under the NHS, then your treatment is predominantly free, and medication prescription charges apply. And there are some eligibilities that can have free prescriptions. So those that are over 65, if you're under 18 in full-time education, then you get free prescriptions. Or if you're receiving some benefits within the UK, then you can get free prescriptions. But on the whole, people pay for prescription charges here, but their treatment under the NHS is free. But there is a private sector as well here that you would then pay for your treatments and your prescriptions.
Yeah, I think it's quite similar in Singapore, but I don't think well, not a lot of people get it free, so they have to fill in some paperwork and proof that their income falls below a certain range in order to get healthcare free. But the majority of us get it quite subsidized up to about, I think, 70%. There's private healthcare here as well. I think in the US, a lot of the healthcare billing matters under insurance, right, Kimberly?
Yeah.
So yeah, our insurance is like built separately. It covers a whole range of stuff, but they don't really show us the insurance at the pharmacy, so they have to make payment up front, and then there'll be a reimbursement done later.
Okay. Yeah, ours is to some extent based on need as well. So for patients who have, financial difficulties, there are programs in place where it's paid for. But yes, it's very complicated here.
Someone's asking if you could give more details on the immunization program training.
Yeah, certainly. So there are now a lot of training programs in the United States. There's the one that I designed with my colleagues at WSU was the first one. And so I can talk just briefly about that. It is 6 hours. So it's 2 hours of independent pre-work that the technicians do that covers a lot of background information about the diseases, some background information on administering an immunization and what, kind of needs to happen. And then we do a 4-hour live in-person training session where the technicians learn to actually administer the immunizations and at the end have to demonstrate that they can administer an intramuscular and a subcutaneous vaccination successfully to get certified to complete the program. So if I get the question a lot, what happens if they don't? What happens if they don't on the first try successfully administer an immunization? And the answer is they get coaching and then we try again as many times as we need to. So we all end up with a lot of Band-Aids on our arms by the end of the training because there's lots of practice vaccinations. But what I have found is that technicians absolutely can do this and, maybe need a couple practice tries, just like pharmacy students in the PharmD program do here as well.
Okay, well, we're still on this. Someone asked if immunization requires a recertification, or is it just one time?
Good question. So it depends on the organization where you're working and also where you got the certificate from. So I'm more familiar with the American Pharmacists Association program because that's what mine has morphed into over the years. And so with that one, there is a date on the certificate that shows that you're certified for 3 years from the training date. That's not to say that after the 3 years are up, you can't immunize anymore. It's just saying that this is a topic where there's new information pretty often. Things change. As we know during COVID, it seemed like every week things were different. So it's just saying that, your knowledge would be considered up to date for 3 years. And at that point, it would be up to, the technician themselves and their employer to decide whether they needed a recertification class or whether they were, able to continue to immunize.
Okay, there's one more question on immunization. They're asking if it's under the PharmD program or is it a certificate program post-graduation?
Good question. So our PharmD students do learn to immunize, and it is a accreditation requirement that PharmD programs in the United States include some element of that. So I teach this content at the university where I work, and so all of my students graduate certified to administer immunizations, and many of them administer hundreds of immunizations before they graduate because they learn as a second-year student and they go give lots of vaccinations. It's very similar with our technician programs. So many pharmacy technician training programs in the United States now include an immunization component just because this has become, such a big role here in the United States. Additionally, you can do this postgraduate though. That's not to say that, they couldn't. So if a technician graduated from their training 15 years ago and this didn't exist and they want to go through training, there are programs available for that. And the same with pharmacists. So I've worked with pharmacists here who, graduated many years ago before training was widespread, and they get to take a course as a graduate as well. So both are available for pharmacists and for technicians.
Okay. We have one last question, I think it's for all three of us. So Beth is asking, what activities do you believe pharmacy technicians should be authorized to complete that hasn't been enabled yet, so that they're able to use the full scope of their training and skills?
Great. So I'd love to jump in just to start this, because I think there are tasks we've identified, and there are probably a lot of tasks we haven't identified yet that are going to be amazing roles for pharmacy technicians. When I was working with the director of the Idaho Board of Pharmacy, Alex Adams, to implement immunization training for technicians at first, the way we really differentiated this is what is a clinical task and what is a technical task. So a clinical task is something that requires a pharmacist level of clinical decision making. So for example, should this patient have a pneumococcal vaccine today? A pharmacist should be the one ultimately making that call. A technician can say, I think this person should be vaccinated, but a pharmacist should be looking at the patient's medical history, their medical conditions, their vaccination history, and making that decision. Is this, drug really the right thing for this patient? Technical tasks are things that do not require clinical judgment. And so administering an immunization is one of those things, right? It doesn't require an in-depth knowledge of immunology to stick a needle in somebody's arm safely and carefully and do a great job taking care of the patient. So that to me is how, moving forward, I would differentiate between what is an appropriate task for a pharmacy technician and what is not, is really what are clinical tasks, what are technical tasks, given the education system remains the same. So if the education system, here changed, like in the UK, you have a lot more opportunity, it sounds like, for advancement of pharmacy technicians. It's not just one level, there's multiple levels. And like in Denmark, the pharmaconomists, their education is different. So I think if, given where we're at in the United States, I think it's clinical versus technical. If the education system changes, that would change as well.
Yeah, and I think in the UK, I guess we don't know the unknown yet. I mean, 5-10 years ago, we didn't know that pharmacists and pharmacy technicians would be undertaking the roles they do now. So I guess we don't know what the next 5 or 10, 20 years is going to bring for us either. But I do see more clinical roles being undertaken by pharmacy technicians here in the UK, running clinics, checking blood results, making decisions, and obviously escalating if they do need to. If they feel like it's outside of their scope of practice and knowledge, then obviously escalating. But we do have pharmacy technicians that run like renal clinics, for example, hypertension, and I think that that's only going to grow for us, not just within the UK, but internationally as well. So I'm excited for what the future brings.
Yeah. So as a pharmacy technician in Singapore, I do see lots of opportunities for us to grow in terms of clinicals and, even with automation and pharmacy operations. It's really exciting right now how we are recognizing the value of the support workforce. So yeah, I think if it's something that we're able to train the techs to do, it's something that we'll be able to expand into. Okay, so that's it. Thank you to both speakers.
One more.
Yeah.
Sorry, yeah, I thought of one specific example that I wanted to respond to the person that asked that question. A new one, I think, that is coming up that we need to do more of is point of care testing, because technicians did that during COVID, right? Technicians can do point of care testing. It's perhaps the reading of the results, may still be a clinical task, at least here in the US, because Rebecca, like we said, it's different, but point of care testing, there's a lot of opportunity to expand that into a lot of things that are not just COVID. And I think that's the future for pharmacy technicians. I think we're going to see more expansion into that role.
Yeah, okay. Thank you, speakers, and thank you everyone for attending today's talk. Kimberly, Kathy says she'll see you in Brisbane.
Thanks. I'll be there. If anybody else on here too wants to chat about this in Brisbane, let me know. I'd love to do that.
Okay. Thank you everyone for attending today's talk. Thank you to the speakers. It's been a really great session and I really learned a lot today. So thank you and have a great day from wherever in the world you are.